Your grandmother is taking a pill right now that could be stealing her memories. She doesn't know it. Her doctor doesn't know it. The box doesn't say it. And by the time she figures it out, it might be too late. This is the story of a pill that's in millions of American homes. A pill that costs a few dollars. A pill that's on an open shelf. A pill that most people think is completely harmless. It's 11:47 p.m. on a Tuesday night in a quiet neighborhood outside Cleveland, Ohio. A man named Robert sits at his kitchen table. He's 76 years old. He's a retired school teacher. He taught history for 43 years at the same high school. His granddaughter came to visit today. They spent the afternoon playing in the backyard. His allergies have been bothering him. The pollen count is high this season. His nose is stuffy. His eyes are itchy. And now, as he gets ready for bed, he reaches for the same pink box he's been reaching for almost every night for the past 8 years. It's Benadryl. Diphenhydramine. The little pink pill that costs a few dollars at any drugstore in America. No prescription needed. No doctor's visit required. It's on an open shelf, right next to the aspirin and the vitamins. And Robert, like millions of other Americans, believes it's completely harmless. He takes one pill. Just one. He swallows it with a sip of water. Then he goes to bed. Tonight, Robert will sleep soundly. The Benadryl will do exactly what it's supposed to do. It will dry up his runny nose. It will stop the itching in his eyes. And it will make him drowsy enough to fall asleep. But while Robert sleeps, something else is happening. Something he can't see. Something nobody told him about. Inside Robert's brain, a chemical messenger called acetylcholine is being blocked. Acetylcholine is the messenger his brain uses to lay down new memories. The name of his granddaughter's new puppy. The route to his doctor's office. The recipe for his wife's famous apple pie. It's the messenger that keeps his mind sharp and alert during the day. And the pink pill he just swallowed is blocking it. The next morning, Robert wakes up feeling groggy. He searches for his glasses. They're on the nightstand, right where he left them. But he doesn't see them at first. He looks past them, then around the room, then back at the nightstand. Where did I put my glasses? His wife points to them. They're right there, honey. Robert laughs it off. Getting old, he says. But it doesn't stop there. A few weeks later, Robert forgets where he parked the car at the grocery store. A few months later, he can't remember the name of his neighbor of 15 years. A year later, he stands in the kitchen, opens the refrigerator, and forgets what he went to get. His family notices. They start to worry. Maybe it's just age, they tell themselves. It's normal. He's getting older, but is it? Or is it the pink pill? Here's what Robert's doctor never told him. And what most doctors never tell their patients. The American Geriatrics Society, one of the most respected medical organizations in the country, has a list called the Beers List. It's a list of medications that older adults should avoid or use with extreme caution. And diphenhydramine, the active ingredient in Benadryl, is on that list. Why? Because a growing body of research has linked anticholinergic drugs like diphenhydramine to an increased risk of dementia in older adults. In 2015, a landmark study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older for over a decade. The researchers found that people who took anticholinergic drugs like diphenhydramine for the equivalent of 3 years or more had a 54% higher risk of developing dementia compared to those who took them for 3 months or less. 54%. That's not a small number. That's more than half. More than half again the normal risk from something most Americans treat like candy. Since that study, a steady stream of new research has corroborated this link. In 2023, a study found that taking any anticholinergic drug was associated with a 40% higher risk of developing mild cognitive impairment. In 2024, the Journal of Allergy and Clinical Immunology confirmed that while newer antihistamines carry less risk, the older ones like diphenhydramine remain a serious concern. The evidence keeps building. The message keeps getting clearer. Now Robert is 81 years old. He doesn't teach history anymore. He can't. He can't remember the dates of the Civil War. He can't remember his students' names. He can't remember the route to the school where he spent 43 years of his life. His wife, Margaret, looks at the man she married 53 years ago. He's still there. His body, his smile, his kind eyes. But part of him is gone. Part of him slipped away, slowly, year by year, night by night. And Margaret can't help but wonder. Was it the pink pill? Robert never knew. Nobody told him. His doctor never mentioned it. The pharmacist never warned him. The box didn't say anything about dementia. It just said, relief of allergy symptoms. Helps you fall asleep. Right now, in millions of homes across America, from New York to Los Angeles, from Chicago to Miami, there's a pink box in a medicine cabinet. And someone in that home is taking it. Not for a day. Not for a week. For years. Maybe it's for allergies. Maybe it's for sleep. Maybe it's for a cold. Maybe it's the PM version of another medication. Because many nighttime pain relievers and cold medicines contain diphenhydramine. They're often just Benadryl wearing a different name, Advil PM, Tylenol PM, Nitol, Somanex, Unisom, and countless store brands. All of them, quietly delivering the same drug into millions of bodies, night after night, year after year. And the people taking them believe they're safe. Why wouldn't they? They're over the counter. They're cheap. They've been around for decades. They must be safe, right? But here's what the research keeps showing. Anticholinergic drugs like diphenhydramine can have immediate cognitive side effects. Drowsiness, confusion, memory loss. And over the long term, they may be doing something far more serious. They may be affecting inflammation and blood flow in the brain, which can result in memory loss and weaken cognition. They may be contributing to cognitive decline in ways that look exactly like early Alzheimer's, when the real cause is the medication you've been taking every night. This isn't about scaring anyone. This is about awareness. This is about the simple truth that a medication taken for one purpose can have unintended effects elsewhere. And when those effects involve the brain, the stakes are incredibly high. Now let me ask you something. Look in your medicine cabinet. Do you have Benadryl? Advil PM? Tylenol PM? Take a moment and think about it. Have you noticed any changes in your memory over the years? Any forgetfulness that you've been blaming on age? Comment below and let me know. Your answer might help someone else realize they're not alone. Here's something that might surprise you. The research doesn't just apply to Benadryl. There's a whole class of medications that work similarly. Some are for bladder control. Some are for anxiety. Some are for depression. All of them, in their own way, can affect the same chemical pathways in the brain. And when you combine them, the effect can multiply. This is something researchers call anticholinergic burden. It's the cumulative effect of multiple medications, all working against the same memory chemical. In 2022, a study published in Age and Aging tracked more than 280,000 older adults. Those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years. More than double the risk. And the overwhelming majority had no idea they were taking anticholinergic medications at all. No one had ever explained it to them. Think about that for a moment. Think about what it means for someone to go about their life, taking their medications as prescribed, believing they're doing the right thing for their health, while the very medications they trust are quietly working against them. Not out of malice. Not out of negligence. But simply because nobody connected the dots. Nobody looked at the full picture. Let's go back to Robert for a moment. Imagine if Robert had known. Imagine if, 8 years ago, someone had sat him down and said, "Robert, there's a safer option. You don't need to take that pink pill every night. Let's find something that works for you without the risk." Imagine if his doctor had told him. Imagine if the pharmacist had warned him. Imagine if the box had a label that said, "Long-term use may be linked to memory issues in older adults." Robert didn't have that chance. But you do. Before we continue, I want you to save this video. Bookmark it. Share it with someone you love. Because the information I'm sharing right now could change their life. It could be the thing that makes them ask the right questions. It could be the thing that protects their memories. So what do? Do you throw away the pink box right now? No. Never stop a medication on your own. Not even an over-the-counter one. Because if you've been taking it for a long time, stopping suddenly can cause problems. Your body has adapted to it. Your sleep patterns may be dependent on it. Your allergies may be managed by it. What you need to do is have a conversation. Have a conversation with your doctor. Have a conversation with your pharmacist. Ask them this question. I've been taking diphenhydramine, Benadryl, for a while now. Is it safe for me? Are there safer alternatives for my age? Because here's the good news. There are newer antihistamines like loratadine, which is sold as Claritin, and cetirizine, sold as Zyrtec, that do not cross into the brain the way diphenhydramine does. They are far safer for the long haul. They don't block acetylcholine. They don't interfere with your memory. They don't carry the same risk. For sleep, there are non-medication options. adjusting your bedtime routine, reducing screen time before bed, creating a calm, dark environment. And if medication is still needed, there are options that don't affect the brain the same way. And here's something else worth considering. Many people take diphenhydramine for allergies that could be managed with other strategies. Saline nasal rinses, air purifiers, identifying and avoiding triggers. Sometimes, the simplest solutions are the most effective. Robert eventually made the switch. He moved to a newer antihistamine. His allergies are under control. He sleeps better. And his family has noticed a difference. He's more present. He remembers things. He's not as confused. The change wasn't immediate. It took time. But slowly, Robert started to feel like himself again. Not the Robert who was fading away, night after night, pink pill after pink pill. But the Robert who taught history for 43 years. The Robert who remembered every student's name. The Robert who knew the route home. Here's the truth, and it's the reason I'm sharing this story with you today. Medication-induced cognitive decline is often reversible when it's identified early. When you reduce the burden on the brain, many people regain clarity, energy, and memory within weeks or months. The brain is resilient. It wants to heal. It wants to remember. But it needs you to give it a chance. This isn't just about one medication. This is about all the medications we take without fully understanding their effects. It's about the cumulative impact of everything we put into our bodies. It's about the questions we don't ask because we assume someone else has already asked them. It's about taking ownership of your health in a way that protects your most precious asset, your mind. If you know someone who takes Benadryl at night, tag them in the comments. They might not know what you know. You could help them more than you realize. Sometimes the most powerful thing you can do for someone is share information that could protect their health. And that's what this is all about. So tonight, before you go to bed, I want you to do something. I want you to go to your medicine cabinet. Look at what's inside. Find the pink box. Read the label. See if it says diphenhydramine. If it does, don't throw it away tonight. But tomorrow, call your doctor. Schedule an appointment. Or call your pharmacist. Ask the question. Have the conversation. And while you're at it, take a look at everything else in that cabinet. Are there other medications that might be affecting your brain? Are there combinations that could be increasing your risk? Your pharmacist is an incredible resource. They can review all your medications, look for interactions, identify potential risks that even your doctor might have missed. Ask your doctor to review your medications annually. It's called a medication reconciliation, and it's one of the most valuable things you can do for your long-term health. Bring a list of everything you take, including over-the-counter products and supplements. Ask if any of them are anticholinergic. Ask if any of them interact in ways that could affect your cognition. Ask if there are safer alternatives. Your memories matter. Your mind matters. The moments you share with your family, the names, the faces, the stories, they matter more than a cheap pink pill. They matter more than convenience. They matter more than habit. They are the threads that connect you to the people you love, and they are worth protecting. Robert remembered today. He remembered his granddaughter's name. He remembered the route to the grocery store. He remembered the recipe for his wife's apple pie. It's not a cure. It's not a miracle. It's simply what happens when you give your brain a chance. When you make informed choices. When you ask the questions that need to be asked. This is your opportunity. This is your moment. The information is here. The research is clear. The path forward is straightforward. All you have to do is take the first step. Go to your medicine cabinet tonight. Look for the pink box. And tomorrow, make the call. Have the conversation. Take control of your health in a way that protects your most precious asset. Your mind. Because you deserve to remember. You deserve to be present. You deserve to know the truth about what you're putting into your body. And now, you do. Thank you for watching. If this information was helpful, share it with someone you care about. Someone who might have that pink box in their cabinet. Someone who might not know what you now know. Together, we can make a difference, one conversation at a time. The information in this video is for educational purposes only. Always consult your healthcare provider before making any changes to your medications.